Just finished my ward rounds. One of my patients is going home today. He had his heart surgery 5 days ago. He had first presented a few weeks ago. He had a heart attack and was quite unwell. And an angiogram was done and showed that he had multivessel coronary artery disease. So this is his angiogram, the left side of the coronary arteries. This is the circumflex coronary artery, and it was very diseased right here. So there was very little blood going to the heart. And over here as well, the left main stem and the left anterior descending was also very diseased, and the vessel was very narrowed. And this is the left anterior descending artery at the front. You can see it had blocked off and only a little bit of blood was going through one of its branches, the diagonal artery. So a whole big area of the heart was not being supplied with blood. Because of that, part of the heart had not been working very well, and some thrombus had formed inside the left ventricle. This is the main heart chamber, and these blood clots had formed inside it. So he was at risk of getting a stroke because these blood clots can dislodge and go to the brain. So we needed to thin the blood down a bit more before the surgery, and we needed actually to dissolve all the thrombus in the left ventricle before his surgery. So his surgery was delayed a bit. We started him on some strong blood thinners, some strong anticoagulants, and fortunately all the blood clots removed, and then he could go for his coronary artery bypass graft surgery, which was done 5 days ago. And he has made a very good recovery. He's walking around and does not need any oxygen, and so he's going home today. Most patients go home after coronary artery bypass graft surgery between 5 to 7 days after their surgery. Once they're able to walk around independently, and when they do not need any more oxygen, then they can go home. And this is usually between 5 to 7 days after surgery. The younger patients tend to go home earlier, but having said that, one of my patients in his 60s went home 4 days after his surgery, sometime last week. So it does vary between different patients depending on their general condition and how fit they are before the surgery. So I'll see this patient again in a week's time to check on his wounds, do some blood tests and a chest x-ray. The wounds were all very good. Depending on the condition of the wound, sometimes we would leave it exposed. Sometimes we would cover it again with some waterproof dressing, and they should avoid putting too much strain on their chest wall, their sternum, for a few weeks. The full healing process takes about 3 months for the sternum to heal completely, so they should avoid anything too strenuous. They should not be lifting anything too heavy or pulling on anything too heavy for 3 months. Most patients are actually quite okay already. After a week or two, they can start driving again after a month, and we encourage them to walk around as much as possible to get the circulation working and their lungs functioning normally again. So I hope that was interesting. Thank you for listening. Please do like and share this video if you found it informative. Thank you.